Okay guys, this is Caesar with Nursing School Made Easy, and today's lecture is going to be on Hirschsprung's disease. Let's do a quick view of anatomy here. So let's say we're going to say this is a baby, okay? Because in Hirschsprung's disease, this is a congenital anomaly, meaning you're born with it. And typically this is seen in newborns and babies and infants. So let's discuss a little bit of that anatomy. So remember, here we can have mouth, we have esophagus, we have stomach. Stomach's going to turn into small bowel, right? And that's going to turn into large bowel. Ascending colon, if you remember your anatomy. And we're going to turn into the transverse colon. Then descending colon. Sigmoid. And rectum. Right? Well, in Hirschsprung's disease, again, this is a congenital anomaly, and patients will typically suffer from what's called megacolon. Megacolon is like the name says, a large colon. So this would be something, for example, like a regular normal patient. And megacolon, what end up happening is the sigmoid region, rectal region will actually get big, hence the name megacolon. Now, why? Again, this is a congenital anomaly, and it has to do with problems with the ganglion cells. Anytime you have to have a bowel movement, your brain is told, hey, we need to go to the bathroom, stat, let's go. Make it to the bathroom. Well, in these patients, they don't get the signal. Okay, so they do not or are unable to go to the bathroom because their ganglion cells are damaged. So again, the stool comes through the GI tract and just sits here. As a result, the colon will become overstretched. And I'm going to use my little balloon here just to further cement this into your brain. So what will happen is those muscles will get stretched, and it just gets bigger and bigger and bigger and bigger in size. Okay? So that's pretty much what Hirschsprung's disease is. Now, what are some signs and symptoms that your patient will have? Again, this is typically found in newborns and babies and infants. So number one, signs and symptoms. You have something called Antero Colitis. So a possible infection. Now the reason you're going to have this infection is because, again, stool is just going to be sitting here. As you know, stool has large amounts of bacteria present in it. It's just waste product. So if this bacteria just sits in here, it increases the likelihood of an infection to occur. As a result, many of these patients will again suffer from Antero Colitis. As a result of this Antero Colitis, patients may suffer also from fever. Okay, we talked about this. Stool is going to remain here. Not only that, but it's actually going to begin to back up. Okay, so all this will also expand. It'll distend. This will all get bigger, causing potentially a huge obstruction everywhere. So again, everything is going to be backing up, backing up, backing up, backing up, backing up, because food will no longer be able to pass through. So that increase in abdominal distension will also result in abdomen pain. And before we just mentioned it, abdomen distension, or increase in abdomen girth. Number 5, constipation. Again, we just talked about this nausea, vomiting. When you're going to have all this vomiting because you're having the constipation, food can no longer pass through, so as a result, you're going to want to vomit. Number 7, here's a biggie. Notice for the nclex. Failure to pass meconium, and this is that first stool for newborns. Okay, so they are unable to pass meconium. If they are unable to pass that meconium, that is a huge signal that maybe something is going on with the bowel. Number 8, failure or the inability to gain weight. Okay, they can't wait because they're not able to, one, fully absorb the nutrients. They're constipated, so they're constantly maybe throwing up. Okay. Now, a couple of things that will occur with these patients is they may have some type of surgical therapy. One of the first things that may be done may be something like a colostomy put in place. I'm going to try to let that megacolon rest. So the colostomy may be put in place. Or number 2, a bowel resection to remove part of the bowel that is affected. So a bowel resection may be performed. And then a colostomy may be put in place to again let that bowel heal. Once it is healed, then the colostomy may be removed. So what are some interventions that you're going to be doing for these kiddos? Number 1, you'll provide a stool softener to prevent constipation. Number 2, low fiber, high calorie, and high protein diet. Again, these kiddos are growing fast, so you want to provide high calorie and high protein. Get those muscles to gain some mass. You may possibly do some rectal irrigation. And again, this is to prevent constipation. Try to get some of those stool contents out. You will monitor I&O. Along with that, you will take a daily weight and measure abdominal girth on a daily basis. Again, one of the things that you worry about is constipation. So you definitely want to make sure that that patient, that baby, isn't becoming constipated, because that can cause some complications. You will also avoid taking a rectal temperature. Now, if, for example, that patient does have some type of surgery, you will always assess the surgical site. You will assess for drainage. You will look at the stoma site. And you will make sure that that stoma site is red and moist. You will also make sure that there isn't any excessive bleeding. Is there any hemorrhage? And if so, you want to report that to the physician immediately. Number 9, if they did have some type of surgery, you always want to place them in an NPO status until bowel sounds return. Again, you do not want to feed them if there are no bowel sounds, because then you are, again, going to suffer some pretty dramatic complications. So again, you maintain NPO status until bowel sounds return. 10, you will teach the parents instructions regarding colostomy care, signs of infection, okay, any excessive bleeding, pus, excessive drainage. You will give that information to the parents. So this will be the job of an RN, not an LPN, and definitely not a CNA. Okay, so this turns into delegation here. Only you, the RN, can give these instructions and teach these instructions to the parents.